Hi, Cam.
Having a food allergy, and when you're a parent, your children rely on you and they need you to be there for those important moments. And God, I'm gonna get emotional, I'm sorry. I haven't really thought about this.
Let's go inside. Let's see.
My primary food allergen is milk. Growing up, I did not have a lot of dairy alternative options. And that was hard. And so I had a lot of obscure replacements. I would use apple juice or orange juice in my cereal. My mom would cook French toast with orange juice. When I think about that, I laugh, but it's all I knew, and that's what I did. My mom is what you would call a helicopter parent. She would over-communicate what I could and couldn't eat, and then sometimes she would even supply my own food just to keep me safe at parties. Going to school parties and birthday parties was always a hard thing for me because everyone always has pizza and birthday cake, and I could never have pizza or birthday cake. So I think I always felt different, and I never wanted to bring attention to it.
I'm gonna try to catch her and drop her.
So my 7-year-old daughter has become very aware of my food allergies, and she will advocate for me at times when I haven't stepped up to the plate or verbalized something. Living in this environment, she's learned to advocate, for me and to advocate for others, which is really special, and I felt like something I didn't have growing up. My role as a mom is really busy, going to all their events. And I'm a nurse practitioner, and I primarily care for children with disabilities. And so food allergies is, I would say, actually a hidden disability. I've cared for children who have had food allergy reactions, who we monitored for a period of time. But I've also taken care of children and young adults who required, quite lengthy hospitalizations for their anaphylactic reactions. Seeing how life is so fragile and to have a treatment option available to me was an amazing opportunity and something I really wanted to jump on. So I'm in a trivia league, and my friend at trivia actually told me about XOLAIR and that it received FDA approval and that I should look into it. With XOLAIR, I still have to be hypervigilant, I still have to read labels, I still have to avoid my allergen. But now that there's dairy alternatives and I have XOLAIR, I feel that I'm able to share those experiences with my family.
What is XOLAIR? XOLAIR, omalizumab for subcutaneous use, is an injectable prescription medicine used to treat food allergy in people 1 year of age and older to reduce allergic reactions that may occur after accidentally eating one or more foods to which you are allergic. While taking XOLAIR, you should continue to avoid all foods to which you are allergic. It is not known if XOLAIR is safe and effective in people with food allergy under 1 year of age. XOLAIR should not be used for the emergency treatment of any allergic reactions, including anaphylaxis. Important safety information. What is the most important information I should know about XOLAIR? Severe allergic reaction. A severe allergic reaction called anaphylaxis can happen when you receive XOLAIR. The reaction can occur after the first dose or after many doses. It may also occur right after a XOLAIR injection or days later. Anaphylaxis is a life-threatening condition and can lead to death. Go to the nearest emergency room right away if you have any of these symptoms of an allergic reaction: wheezing, shortness of breath, cough, chest tightness or trouble breathing, low blood pressure, dizziness, fainting, rapid or weak heartbeat, anxiety or feeling of impending doom, flushing, itching, hives or feeling warm, swelling of the throat or tongue, throat tightness, hoarse voice, or trouble swallowing. Your healthcare provider will monitor you closely for symptoms of an allergic reaction while you are receiving XOLAIR and for a period of time after treatment is initiated. Your healthcare provider should talk to you about getting medical treatment if you have symptoms of an allergic reaction. Do not receive and use XOLAIR if you are allergic to omalizumab or any of the ingredients in XOLAIR.
I don't know, it's kind of indescribable. Your whole life, you're told it's something to be scared about and, that you're worried about. I think I always felt alone. I was one of the few people who had food allergies. And so now I hope most children know they're not alone. The prevalence has really increased. But I think, it's okay to be different, and it's okay to advocate for yourself.
Before receiving XOLAIR, tell your healthcare provider about all of your medical conditions, including if you have a latex allergy or any other allergies, such as seasonal allergies. The needle cap on the XOLAIR pre-filled syringe contains a type of natural rubber latex. Have sudden breathing problems, bronchospasm. Have ever had a severe allergic reaction called anaphylaxis. Have or have had a parasitic infection. Have or have had cancer. Are pregnant or plan to become pregnant. It is not known if XOLAIR may harm your unborn baby. Are breastfeeding or plan to breastfeed. It is not known if XOLAIR passes into your breast milk. Talk with your healthcare provider about the best way to feed your baby while you receive and use XOLAIR. Tell your healthcare provider about all the medicines you take, including prescription and over-the-counter medicines, vitamins, and herbal supplements. How should I receive and use XOLAIR? When starting treatment, XOLAIR should be given by your healthcare provider in a healthcare setting. If your healthcare provider decides that you or a caregiver may be able to give your own XOLAIR pre-filled syringe or autoinjector injections, you should receive training on the right way to prepare and inject XOLAIR. Do not try to inject XOLAIR until you have been shown the right way to give XOLAIR pre-filled syringe or autoinjector injections by a healthcare provider. Use XOLAIR exactly as prescribed by your healthcare provider. The XOLAIR autoinjector, all doses, is intended for use only in adults and adolescents aged 12 years and older. For children 12 years of age and older, XOLAIR pre-filled syringe or autoinjector may be self-injected under adult supervision. For children 1 to 11 years of age, XOLAIR pre-filled syringe should be injected by a caregiver. See the detailed instructions for use that comes with XOLAIR for information on the right way to prepare and inject XOLAIR. XOLAIR is given in 1 or more injections under the skin, subcutaneous, 1 time every 2 or 4 weeks. In people with food allergy, a blood test for a substance called IgE must be performed before starting XOLAIR to determine the appropriate dose and dosing frequency. Do not decrease or stop taking any of your food allergy medicine or allergen immunotherapy unless your healthcare providers tell you to. You may not see improvement in your symptoms right away after XOLAIR treatment. If your symptoms do not improve or get worse, call your healthcare provider. If you inject more XOLAIR than prescribed, call your healthcare provider right away. What are the possible side effects of XOLAIR? XOLAIR may cause serious side effects, including cancer. Cases of cancer were observed in some people who received XOLAIR. Fever, muscle aches, and rash. Some people get these symptoms 1 to 5 days after receiving a XOLAIR injection. If you have any of these symptoms, call your healthcare provider. Parasitic infection. Some people who are at a high risk for parasite worm infections get a parasite infection after receiving XOLAIR. Your healthcare provider can test your stool to check if you have a parasite infection. Heart and circulation problems. Some people who receive XOLAIR have had chest pain, heart attack, blood clots in the lungs or legs, or temporary symptoms of weakness on one side of the body, slurred speech, or altered vision. It is not known whether these are caused by XOLAIR. The most common side effects of XOLAIR in people with food allergy: injection site reactions and fever. These are not all the possible side effects of XOLAIR. Call your doctor for medical advice about side effects. You may report side effects to the FDA at 800-FDA-1088 or www.fda.gov/medwatch. You may also report side effects to Genentech at 888-835-2555 or Novartis Pharmaceuticals Corporation at 888-669-6682. Please see full prescribing information, including medication guide, for additional important safety information.